If you're documenting homebound status like most nurses, you might be setting your agency up for a Medicare denial. The problem is, it's not your care, it's your wording. I see this all the time. Nurses will write things like, patient is homebound due to weakness or requires assistance to leave home. That sounds right, but to an auditor, well, that's not enough. I've been a nurse since 2000 and over a decade in home health, and I can tell you this is one of the biggest reasons good nurses get denials. Because we're not taught how Medicare actually thinks. Take a look at the condition. What is physically or medically limiting them? For example, weakness, shortness of breath, pain, fall risk. How about the effort? What does it actually take for them to leave? Is it taxing? Do they need assistance? What devices do they need? And then the risk. This is where most nurses fail. What happens if they do leave? Examples are fall risk increases, oxygen desaturation, severe fatigue, pain gets worse. This is an example of weak documentation. Patient is homebound due to weakness. But this is stronger. Patient requires assistance of one person to leave the home due to generalized weakness and poor balance. Leaving the home requires considerable and taxing effort and places the patient at risk for falls. How about this one? Patient experiences shortness of breath with minimal exertion. Ambulating in the home results in oxygen desaturation and severe fatigue, requiring frequent rest periods. That's the difference between a note that gets approved and one that gets denied. Remember this: condition, the effort, and the risk. In the next video, I'm going to show you exactly how to prove skilled need, which is the second biggest reason nurses get denied. If you're a home health nurse trying to get better and protect your documentation, make sure you subscribe. I'm breaking this down step by step